Okay, thank you for being here. Good afternoon, everyone. My name is Chandra Gracia Anweta, a business and innovation analyst, and I'm here with my colleague Kiara Zocchi, and she is a senior innovation consultant at PNO CiaoTech. And at PNO CiaoTech, we specialize in technology and innovation consulting, focusing on helping stakeholders succeed in competitive markets. And today, we will guide you through some of the existing projects we've been working on in health tech, including the ONCOVALUE project, where we conducted a technology and market assessment, and the WARIFA project, where we provided support for their funding application. Okay, let's get started. So about our company, PNO CiaoTech, we are part of the PNO Group, a European leader in public funding and innovation services. Operating in 10 countries with over 650 employees, we have helped raise over 1 billion euro annually for our clients through structured funding acquisition and grant application writing. Our support extends beyond funding into innovation intelligence, project implementation, and digital tools designed to boost the efficiency of these processes. And with over 80 EU projects and more than 6,000 applications per year, we are proud to be a trusted partner in Europe's innovation landscape. Our services are interconnected to provide a holistic approach to innovation and project success. So at first, we offer the RD&I intelligence, which gives clients innovation insights and benchmarking to guide decision-making. And we also provide public funding services, helping companies develop winning strategies and also to secure grants and incentives. The next, we have digital tools to ensure our clients benefit from the impactful and efficient funding processes. And finally, our project implementation, it helps ensure compliant and significant execution. So from concept to completion, maximizing the value of public funding. We are fortunate to work with some of the most prominent names in the life science sector. Some of our clients range from major industries like Siemens and Microsoft to leading research institutions like KU Leuven and Fraunhofer. Our collaborative approach has helped these organizations push the boundaries of what is possible in innovation and technology while securing the necessary funding and support to thrive in highly competitive sectors. And this concludes the overview of what we are and who we are at PNO CiaoTech. And in the next slides, we're going to dive deeper into specific projects like ONCOVALUE and WARIFA to see how our expertise directly contributes to these fundings. Okay, so the innovation and healthcare, it is shaped by three key factors. The first is in the innovation itself, the market demand, and also the stakeholder adoption. So for innovation, it must address real healthcare challenges, whether it is to improve patient outcomes, reducing costs, or enhancing quality. But for an idea to succeed, it must be practical and scalable. And then here we have the market demands, and it ensures that innovations are aligned with market needs, whether it is addressing gaps in patient care, or you want to meet regulatory requirements or respond to healthcare trends, the innovation must solve a relevant problem. And without market demand, even the best solution, it will struggle to gain traction. And then the last, we have stakeholders. And here we can include healthcare providers, regulators, and also patients. And the stakeholders are essential to successful adaptation. So for the stakeholders, their buy-in is critical, and innovations need to be tailored to meet their needs, their standards, and also their expectations. And if we engage stakeholders early, it means that it will help smoothen the path of the market entry. And at PNO CiaoTech, we ensure that these three aspects are balanced because it will help position our client's solution for success, and we combine collaboration, readiness, and perfect timing. We can go to the data-driven approach from our company and why it is critical to unlocking the full potential of innovation. So we use tools like WISB, and with WISB we can begin a thorough stakeholder analysis to identify the leading technologies, the key players behind them, and also the state of the art. And this allows us to map the stakeholder network, understanding the connections, the collaborations, and also influence the shape of the innovations landscape. And then we have also the key exploitable results, which is the benchmark, and also these are the innovations with the highest potential for market entry. This process can go beyond the technology itself because it focuses on the technology and its alignment with existing partnership and market trends. And by combining these insights into technologies and stakeholder dynamics, we can ensure that the solutions we support are well positioned to meet market demands, and it will integrate smoothly into the healthcare ecosystem. And one of the prime examples that we have here is the ONCOVALUE project. In this project, we harness the power of the AI to transform real-world oncology data from European cancer hospitals into structured, actionable insights. And these insights are then used by clinicians and regulatory bodies to make better informed decisions. By integrating this data into personalized care, the project enhances cancer treatment efficiently, sustainably, and also it helps the patient outcomes. And the AI-driven platform developed in this project, it provides not only the data sharing capabilities, but also offers tools, training, and guidelines for clinicians and regulatory bodies. And it ensures better management for cancer treatments and a more effective decision-making in cancer care across Europe. And our role in OncoValue is a multifaceted role. We lead the dissemination of findings, ensuring that the critical insights reach the right audiences. And we also focus on exploitation, identifying the most impactful aspects of the project and ensuring that they are fully leveraged to maximize the real-world benefit to support value-based oncology care. And now we can see some of the concrete examples of our performance in the OncoValue project. So here we have the charts that provide a comprehensive overview of the technological trends that we have identified across the oncology and health tech domains over time. At the top left, you can see a clear visual representation of how innovation has evolved from 2016 through to 2023. And here we can see, we can indicate the key points where technological development peaked and where innovation is currently stands. And this chart on the top left, it helps us to pinpoint when and where the highest impacts have occurred, and it will allow us to forecast future opportunities for innovation. And at the bottom left section of the chart, it illustrates the funding sources segmented by region, including funding streams from the Switzerland, the Netherlands, the United States of America, and also the European Unions. And understanding these funding trends, it is crucial because it tells us where the resources are being directed and which projects are receiving the most support. And then now I will guide you to the top right of the presentation here. And here we can see a detailed breakdown of the project data. These are the categories in various stages of development, and we can categorize them by the type of data involved and also the technological services provided. And this granular analysis, it gives us insights into the ongoing process of multiple projects and technologies. And now if you see the middle section of this slide, you can see the classification of the patents. And these are the CPC that are relevant to the key areas of this project. So here we have the diagnosis, we have the data processing, and also we have the graphics. And this patents classification, it helps us to actually map out the areas of intellectual property development, and we can see where future technological advances may arise. So by combining all these layers, our recommendation will be based on the very actionable and data-driven analysis. And then using all of this data, we can go to the very important network map here. If we see this network map, we can go to the left part. And this left part of the chart, it visualizes the similarities among funded projects. And here we can have the axis on the technology and the cancer type. So from this chart, we can understand that the innovation is concentrated and the projects are pushing boundaries in the specific cancer domains. So for example, here, the projects like OncoValue and Incisive, these are positioned on the top right, and this is the leaders in advancing AI-driven cancer care. And on the right part, we have these collaboration networks. This diagram maps out the connection between institutions, industry players, and also the developers. It is important to show how they interact to bring these technologies to life. And by identifying the most influential partnership we can see here in the highlighted ones, we can understand their roles within the broader ecosystem. And we can ensure that the innovations we support are aligned with the strongest network. So this part concludes my part of the presentation. And now we have explored how our data-driven approach helps position innovation in long-term success. And now I will handle this presentation to my colleague Chiara, and she will take you to the next section of today's presentation.
Thank you very much, Gracia. Before to move on with the other second part of this presentation, I would like to know if there are any comment, questions. I would like to have an interactive moment. Let's say that these services that we provide to organizations are very helpful for different kinds of organizations, ranging from small, medium enterprises, startups, and large companies as well, but not limited to, especially when we talk to academia, universities, that are willing to overcome the gap from research to application to market. Let's move on with the funding application support. Sorry, I don't remember it by memory. This is one of the main services of CiaoTech and PNO Group. The funding request support is a service that CiaoTech PNO Group provides to all of our customers, so ranging from academia to industry, passing through association of different sectors for maximizing their impact towards development of product, process, and services, and impact in the market. We try to fill in the gap between research, application, and industrialization. Being a multinational company, as introduced by my colleague Gracia, we are focused on creating continuously knowledge that can be brought to the market and translated into product, so something tangible, a result, tangible result that can be exploited. These are terms that we are used to learn and listen, especially when you are doing research at a level such as the European panorama. Our company has more than 600 people, and most of us are with technical skills and expertise ranging in different kind of scientific field. In this case, today we are here at EventX Life Sciences, but we are not limited to the scientific field of life science and healthcare. Our approach to public funding is structured, and this is an important thing because we are very well organized, and our researchers and team members are grouped into thematic teams. But nevertheless, the process is for all of us the same. We start with the initiate phase, then we move to develop, the apply, and the realize. This is the, let's say, roadmap from the idea to a product, process, or service. The important is to start setting up a public funding strategy. without a strategy, it's not possible to move on anyway. The initiate phase is the very first step, starting from your scientific idea, technological idea, research and innovation idea, market, service provision idea. We start with the identification of potential innovative ideas and searching for funding opportunities at different level. Not only European one, but as we have seen in a previous slide, we are a multinational present in around 10 European countries. So we have the possibility and the structure to monitor regional and national funding opportunities. Then, when there is a first milestone that is very important, not only for us, but also for our customers, which is the no-go or go decision. So if we decide to go, then we will develop the project idea into a more structured project that can be suitable for the funding opportunities that were identified to maximize your funding portfolio. In this case, then, after developing a proposal, there is the request of funding. So after the structuring of the proposal, there is also the request of funding. So following the rules, the indications of the grantor body, we will prepare the documentations needed for the request of funding that may vary from program to program at different level, regional, national, and European. And then there is another important milestone, which is the success of the project proposal request. In the case there is success, we can support in the negotiation phase, which is in Italian, can be translated into istruttoria, fase di istruttoria. And then once the project will get funded, we can support you in the management of the project at a different level and try to support you also in dissemination communication activities, for example. Operatively speaking, our funding strategy starts with a grant scan. This scan gives you the panorama of the funding opportunities that matches with your project idea. Then we set up a grant strategy, which is a strategy that is, let's say, customized to the idea and the funding opportunity panorama. But the objective is always to maximize the funding opportunities to get the most from your project idea and boost from different point of view your research and innovation ideas. Then there is always an application phase, so the job of preparing the request of funding. And then, during the realization of the project, we help practically in preparing the documentation for the reporting phase, which is in Italian la rendicontazione del progetto. This is our structured approach. This approach is ever applied in our European funded project. In this case, we can present WARIFA, which is one of our best cases as a European funded project. WARIFA is a project that uses artificial intelligence for the prevention of chronic conditions related to non-communicable diseases. Practically speaking, with artificial intelligence, we have developed algorithms and innovative machine learning-based algorithms that gather data of your person from different type of sources. For example, you can see in the right image a smartphone, because this app is usable by smartphone or with a web-based application. Data are coming from different sources, so wearable data from the, let's say, digited by the person himself or herself, and other type of data, so data, for example, coming from glucose monitoring system, for example, and artificial intelligence and the partner who let's say, cares about artificial intelligence, has developed an assessment risk factor that analyze all the data gathered from your person and return to you with a risk indicator factor plus personalized recommendations against different non-communicable diseases. So, for example, smoke or other that you have that you can see there. Diabetes, skin cancer, good, let's say, recommendations for a healthier lifestyle. So, this is, let's say, an example that fits not only the event for life science, but also our main services, because in this project, CiaoTech has provided all the value chain of our services. This meaning that with the NCE, so the Norwegian Health Research Center, which is the coordinator of this consortium composed in total by 12 partners of 4 different European countries. We have started with an idea that we have built the consortium, European consortium, and then we move on with the proposal writing, and then the full submission. And then it was luckily it was funded. In the same framework, CiaoTech became also the work package leader. A work package leader means that we are an organization that is responsible for an important activity within a European funded project. In our case, we are responsible for the dissemination, communication, exploitation, and IPR activities. So we are highly interested in turning this prototype in the future, after the project closure, into a future app available for everybody. There is a QR code. If you would like, you can scan it and try to use the WARIFA app, because it is an app for everybody. Thank you very much for your attention. My colleagues Gracia and I are here to reply to any of your questions or to provide you with more information, details about our services. Thank you very much.